Hello, my name is Marcela Hernandez,
I'm Kelsey Cox.
I'm Jocelyn Torres.
and today we are conducting a presentation on ACEs and trauma. So today's learning objectives, by the end of this presentation, you incoming students will be able to define ACEs and understand its categories. You'll be able to recognize the impact of ACEs on health, and you'll be able to identify trauma-related disorders as defined by ATI and other resources. And also you will be able to apply trauma-informed nursing strategies in clinical settings. So let's start with what are ACEs. So ACE stands for Adverse Childhood Experiences. These are potentially traumatic events that occur during childhood, typically before the age of 18. These events include things like physical, sexual, or emotional abuse, neglect, household dysfunctions such as a divorce, substance use, incarceration of a parent, or witnessing domestic violence. But ACEs are just isolated incidents. They often overlap and accumulate. And what's crucial to understand is that these events can have long-term effects, not just emotionally, but also physically and biologically as well. As nurses, especially in mental health, understanding ACEs gives us an insight of why some patients struggle with addiction, anxiety, or chronic health issues. It helps us shift our perspective from asking what's wrong with you to what happened to you. Okay, so why do ACEs matter in nursing? So you might be asking yourself, as nurses, why does ACE matter, right? So it is because ACEs are one of the most powerful predictors of future health, mental illness, and risky behaviors. Research shows that the higher the ACE score is for a person, the higher the risk it is for substance use, depression, heart disease, and even early death. When we understand patients' ACE backgrounds, we're better able to provide trauma-informed care. That means care that is safe, empathetic, and avoid re-traumatizing the patient. It allows us to recognize triggers, practice best patient care, and help the clients build resilience. It helps us recognize ACEs not only to treat symptoms, but see the patient as a whole. Okay, so ACE categories. So the ACE categories are typically divided by three broad categories. So 1, abuse. This includes physical, emotional, and sexual abuse. 2, neglect, both physical and emotional neglect, such as not having basic needs met or not receiving the love or support you need. And 3, household dysfunctions, things like parental separation, substance abuse in the home, mental illness, incarceration, or domestic violence. Each of these categories carries its own kind of emotional weight and can contribute differently to long-term stress, but they all share one thing in common. They disrupt the sense of safety and security a child needs to grow and thrive. Okay, so ACEs by the numbers. Let's talk about the numbers, and there's staggering. According to CDC, a case study was done on ACEs, and it showed that nearly 2/3 of the participants reported at least one ACE, and it said that 1 in 6 had 4 or more. And this is just a historical statistic. Today, in many communities, ACEs are just as prevalent. Rates are higher and marginalized in populations due to social determinants such as poverty, racism, and lack of access to medical care, which we will be looking at in some upcoming slides. As nurses, these numbers just tell us that we will absolutely encounter patients affected by ACEs. It is not a matter of if, it's a matter of when. Okay, so the ACE score assessment. So the ACE score is a tool that helps us quantify these experiences. It's a 10-question questionnaire that asks about various adverse experiences before the age of 18. Each yes response counts as 1 point, so the total score goes from 0 to 10. A higher score doesn't automatically mean someone will have poor health outcomes, but it does mean that greater risk. For example, someone with a score of 4 or more has significantly increased stress or risk for these mental illnesses. But the ACE score is not a diagnosis, it's just a conversation starter. It helps us understand risk provided and to help us support the patients in a better manner. So we can look at some of the questions that are included in this questionnaire. So one of the questions are like, did a parent or other adults in the household often swear at you, insult you, or put you down? Did a parent or other adult in the household often push, grab, slap, or throw something at you? Did an adult or person at least 5 years or older than you ever touch or fondle you, or have you touched their body in a sexual way? Did you often feel like no one in your family loved you or thought you were important or special? Did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you? Was a biological parent ever lost to you through divorce, abandonment, or other reason? And there's more questions, and these questions will give us a better idea about our patient. Okay, so how does ACE affect the brain? So let's look at the biology. Early trauma literally changes the brain. When a child experiences ongoing stress, without the buffer support of supportive relationships, their development of their brain is always in survival mode. This causes an overaction of the amygdala, which is responsible for detecting threats, making the patient hypervigilant. The hippocampus, which helps with memory and learning, can shrink, it gets smaller. And the prefrontal cortex, which controls decision making and impulse control, can be underdeveloped, underdeveloped. This helps explain why someone with a high ACE score might struggle with focus, emotional regulation, or risk-taking behaviors. It's not a moral failing, it's a biology shaped by experiences. Okay, now let's look at trauma in the body. So trauma doesn't just live in the brain, it lives in the body. This concept is well supported by a research in both neuroscience and psychoimmunology. So chronic stress from ACEs can lead to increased inflammation, a weakened immune system, and just a disruption of the hormonal balance, especially the stress hormone cortisol. This dysregulation increases the risk for chronic disease like hypertension, obesity, diabetes, and all other autoimmune conditions. And this is why ACEs are considered a public health issue. They don't just lead to mental illness, they contribute to almost every major chronic disease that we see as nurses in our patients. So as heavy as all this information sounds, there's good news. ACEs are not destiny. With the right support system, interventions, and trauma-informed care, individuals can heal and thrive. In the following slides, we're going to learn and talk about what we can do as nurses with ACEs to build resilience in our patients. Thank you.
Alrighty, so we're basically going to be moving on to what we would see in a patient who has, symptoms of trauma. So these people can be a little bit paranoid. They can be hypervigilant, mostly because of their nightmares. They're having frequent flashbacks from their past trauma. And we could also see guilt, shame, low self-esteem. They obviously don't feel good during these moments of, maybe they re-experience trauma, or like I said, they keep having flashbacks, nightmares, and stuff like that. And for nurses specifically, we want to watch out for emotional numbing. So basically, like a patient withdrawing and not really communicating with you. So we just want to watch out for those factors and make sure we, from the beginning that we meet our patient, just establish that rapport and therapeutic communication. So we move on to types of trauma diagnosis. So we have, so like the previous slide, it was talking about some of the symptoms a trauma patient can have. So it can be pretty much being split into two, which the acute stress lasting up to 3 days, no more than a month, because after the patient is experiencing those symptoms for more than a month, the patient will most likely be diagnosed with PTSD. And it also talks about adjustment disorder, which is a patient sort of reacting to the stressor. Maybe a student failed an exam and they're having those traumatic stresses. So now we're moving on to something very important, dealing with ACEs, which is the social determinants of health. And we're going to be touching on those for the next couple of slides. So first, we're going to talk about economic stability. And when you think about economic stability, you can sort of see where ACEs come into play, because when you think about economic stability, you can think about how the housing being dysfunctional. Maybe the parents aren't making enough money to provide food, healthcare, proper education. So that's when the child could be risk for ACEs. So job insecurity again leads back to the food, healthcare, housing, pretty much being able to take care of the child. And it could also lead to maybe substance abuse or abuse towards the child. So that's something very important to look into when you're talking about ACEs. So neighborhood and built environment. So this is very important because a child can live in a very good, very gated neighborhood with a lot of parks, and they can flourish as a child and just be flourishing. And there's other children that can live in not very underdeveloped communities. Maybe there's a lot of smoke shops nearby or a lot of liquor stores, and these children are susceptible to exposing themselves to not very good behaviors. And usually with neighborhoods and everything, also if a kid doesn't have the opportunity to play in a park, maybe there are no parks, the child could also be susceptible for ACEs. So, alrighty. Moving on to health and healthcare access. So going back to the economic stability, like I said, if the parents aren't making a lot of money, then they can lack with child care for their children, and this can lead to not getting regular screenings done and not being able to have that rapport with any healthcare provider to make sure that everything is going good in their lives. And also about culture and language barriers. There's many people who don't seek help whenever they don't feel like there's a lot of like resources, maybe a patient that speaks Spanish, they go to a clinic and nobody speaks Spanish, they're gonna be less likely to seek help from the clinic or any providers. So for this slide, for education access and quality, you want to start thinking about maybe the lower education schools that don't have the proper resources for the children. So you can think about maybe a school nurse, maybe she's under-resourced for the children. She's not able to properly screen children for signs of trauma or stuff like that. You can also think about transportation. Maybe these children don't have the proper transportation to get them from home to school or from school to home. So there's a lot to think about in this slide, linking them back to ACEs. So we talk about social and community context. So this is basically what any person can go through, but for children they might go through discrimination or racism. But pretty much the slide is making sure that they have positive adult role models to sort of help buffer all the negative things that are happening around them, and to lower the chances to create those ACEs and to build resilience for the children. So on the next few slides, we're going to be seeing how ACEs and coping go hand in hand, and what do we do as nurses to help the children cope better.
Okay, so now we're going to be discussing the impact of ACEs. There's a lot of self-harm and sexual risk-taking that can take place if a patient does have ACEs. So we can see things like smoking, substance abuse, drinking, disordered eating, and you can see here are statistics of how much more likely a patient is to partake in these activities if they do have these adverse childhood experiences. So what is trauma-informed care? This is really important for us as nurses to be able to know how to approach a patient that does have these ACEs. Trauma-informed care is knowing that a patient could have these experiences. We need to be alert that anybody and everybody can experience trauma. So in order to do that, we just need to recognize the fact that they could be experiencing trauma and respond with empathy and having safety as our number one measure for that. So there are a couple core principles that we can follow in order to be able to stay on track with being informed with this trauma. So we can always promote safety, trust and transparency with our patients. We can have peer support, collaboration with our other interpersonal teams, empowerment, and cultural sensitivity. All of these principles are going to help us give the best trauma-informed care as possible as nurses, and work towards not reigniting any sort of trauma that the patient might carry. So what are some interventions that we can do as nurses to make sure that our patient does not go back into these traumatizing situations? So we always talk about the milieu, so we can have a very calm and structured environment for them. We can teach them things about grounding to prevent any sort of outbursts or any other dysregulated emotions. We can teach them how to ground, clapping their hands together, taking deep breaths. We always want to use therapeutic communication and speaking with our patients, and that goes back to trauma-informed care. We want to give them the choices to control what they can in the situation. We want to include them in our care and how we plan on caring for them, to give them some sort of control over what they're going through, and then always collaborate with our other teams. So anybody that we can pull in to help with this patient, whether it be physical therapy, going to the gym, art therapy, music therapy, speaking with our provider, anything that we can do to help our patient with this trauma is going to be the best bet. And there's some do and don'ts here that we can review as well. So building resilience. Resilience is huge because no matter what in life, we're going to experience trauma one way or another. So we have things that are called protective factors in life, and these are things that are going to help us build resilience against this trauma that we are most likely going to experience. So we can have strong relationships, we can have strong relationships with our parents, with our friends, with other family members. Positive relationships go such a long way in inhibiting trauma. Having reliable adults in the child's life, safe school and home environments. Like Jasmine said earlier, it's really big on having quality education, having a good environment like your having parks and other things in your home environment, in your neighborhood, and then teaching coping skills and mental health care. How can we teach our patients how to cope and what can they take home with them after they're not in our care anymore that can ensure that they build this resilience and can move forward without this trauma affecting them. So in conclusion, ACEs are much more common than we think. Like I mentioned previously, more than likely every single person is going to experience trauma in their life. Mental health nurses play a critical role in early identification and healing. So we are the first people that are going to be able to see these signs and symptoms of ACEs and being able to help our patients resolve this issue or help them finding ways to cope with these issues. ATI supports trauma-informed, compassionate, and patient-centered care. So those are things that we can do as nurses and to further our education on how to appropriately work with these patients.
Thank you for watching the presentation.